less than, or is just 2,000 shy of 3 million. The positivity rate also hitting a new record.
Politics, as usual. Our guests for tonight, two political scientists.
Referring to the percentage of people who test positive for the virus of those overall tested. Active cases are at over 157,000, excluding data from 10 testing laboratories. Now, the independent research group Octa says today's tally is much higher than it earlier projected. Octa also says it is possible the country will see 40,000 cases daily towards the end of the week or next week. But Octa warning, once this happens, it would be, quote, close to the worst case scenario. The group explains the country will have difficulty seeing the true COVID-19 situation since it can only conduct 70,000 RT-PCR tests per day. Now, health workers slamming a change in government policy that will give them less time to rest or recover if they catch COVID-19 or become a close contact. Now, Tristan Nadalo has more. Tristan, what else are healthcare workers saying?
Yeah, exhausted, demoralized, and overwhelmed. This is how some groups of health workers describe the situation in hospitals as the country grapples with a surge of new COVID-19 cases. They are also dismayed over a recent decision of the government to authorize hospitals to shorten by half the quarantine for fully vaccinated health workers from 10 to 5 days. The Alliance of Health Workers say this is unacceptable because medical workers are also humans, not immortals. The group adds health workers also need time to recover and heal when exposed to the virus. The Filipino Nurses United also rejects the policy. It says this is an excuse not to hire more health workers. And so far, over 500 nurses and hundreds of allied health workers, members of these groups, have been infected. Back to you.
Yeah, Tristan, the country's biggest COVID-19 referral hospital, the Philippine General Hospital, PGH in Manila, is in crisis mode. Hundreds of its workers are sick. How is PGH dealing with this?
The almost 400 health workers and staff of the Philippine General Hospital have caught the virus, so the hospital administration tweaked quarantine protocols for fully vaccinated staff. The hospital management is letting staff without symptoms and COVID-19 free to work. It also closed down some of its wards so that personnel can be diverted to COVID-19 facilities. The hospital says the staff goes through regular testing and are given complete protective equipment. Back to you.
And how is all over the country?
The average utilization of ICU beds, isolation beds, and COVID-19 beds nationwide is above 35%. But if we zero into Metro Manila alone, ICU bed utilization is now at 51%, isolation beds is now at 50.4%, and COVID-19 wards now at 64.7%. Treatment Czar Leopoldo Vega said that the one hospital command is now receiving 850 to 900 calls a day. That's a big jump from 80 to 100 calls early December. Back to you, Pia.
Tristan Nadalo there reporting. Now, the government considering shortening further the 7-day quarantine for fully vaccinated people identified as close contacts. Presidential advisor for COVID-19 response, Vince Dizon, says they are reviewing the quarantine period in other countries like the United States, which cut the duration down to 5 days after exposure. Dizon, also the testing czar, adds they are also looking at cheaper COVID-19 tests, but still making sure private laboratories do not lose money. Now, despite the record increase in cases, Metro Manila mayors stand firm. The region should stay under alert level 3 for now. George Kiva is joining us now for more details. George, why do mayors want to keep the current restrictions and not escalate that to alert level 4?
Via MMDA Chairman Benher Abalos spoke in behalf of Metro Manila mayors earlier. He gave a number of reasons to maintain the mid-level alert. Most local governments are carrying out laws restricting the movement of unvaccinated and partially vaccinated people. The region has a high vaccination rate with more than 10.5 million people fully vaccinated and almost 1 million with booster shots. Bed utilization rates in ICUs, wards, and isolation facilities are still within range, and citing Octa research, the Omicron surge is slowing down. Abalos says they are continuously monitoring the situation and will immediately call the health department's attention should the numbers continue to rise. Back to you, Pia.
George, over the weekend, there was that unverified information that was going around, as is always the case, no, that Metro Manila would be put under alert level 4, causing quite a bit of panic among people. What do officials say about this?
Well, Abalos says the public should remain calm and listen to reliable sources of information. He warns those spreading misinformation that authorities will run after them. In the meantime, he says, while there are breakthrough cases, most have no symptoms or just mild, which means vaccines are working. Abalos says people should get vaccinated, and those with complete shots should get a booster 3 months after the second dose. Back to you.
Yeah, George, I have another question, but before that, I wanted to follow up lang. No? So you have those local ordinances that would not allow unvaccinated people to leave their homes. But if you want to get them to, to the vaccination centers, meron bang clarification ng local governments dito? Paano yon? So makakalabas ang unvaccinated para magpabakuna o hindi?
Well, they can. If they want to get vaccinated, they can go to vaccination centers because it's still part of getting medical services from the government. So that's an exemption. They want to go out, but of course, people can. There are several other exemptions if they want to get basic needs, no? Or basic necessities, and if they're going to get medical services or other essential services.
Okay, that clarification very important kasi baka may nakikinig o nanonood na hindi pa rin bakunado at nagtatanong nga sila. But George, okay, balik na tayo dun sa isa pang follow-up question. Because COVID-19 Task Force Advisor Dr. Teddy Erbosa is saying that declaring alert level 4 is possible if the healthcare system hits full capacity. And Dr. Erbosa pointing out data on utilization rate does not reflect the actual situation on the ground. So,
right,
you can just add to that. Yeah.
Yeah, that's right. But the main basis that the MMDA or the Metro Manila Council is citing are the numbers that they got from the health department. For the ICU beds, as of January 9, I'm just looking at my numbers right now, the utilization rate is at 52%. The isolation beds is at 50%, ward beds is at 65%, and the use of ventilators is at 26%. If we will going to base this on the DOH's parameters, no, it has to be at 70% before it can be elevated to alert level 4. So, while there are some dynamics to that, no, as what Dr. Erbosa was saying, but we'll see in the coming days if they make another decision as to the alert level status here in Metro Manila.
Yeah, George, I'm sorry, just one last follow-up question. I don't know if the data is on hand with you, pero remember nung Delta surge, no? So August, September, October, at that time, do you remember ano ba yung healthcare utilization rate natin? Sobrang taas, di ba? It was not at this level, right? Am I right?
Yes, you're correct, Pia. No? Yun din yung part ng explanation ni MMDA Chairman Abalos earlier. No? Most of the people right now who are getting sick or getting the virus are just having mild symptoms. And the health department has already given its parameters also on as to who can avail of the home quarantine option. No? So most of the people right now are just having their quarantine at home, and there are several points wherein they can follow for them to be able to recover from the virus. Back to you.
All right, George Cahilas there reporting. Now, in other news, the Commission on Elections is set to decide soon whether former Senator Bongbong Marcos will be allowed to run in the 2022 presidential race. But first, Commissioner Rowena Guanzon wants the Marcos camp to prove he was indeed sick when he skipped the full body's hearing on his disqualification case. Melissa Lopez joins us now for the details. Melissa, Mel?
Pia, COMELEC's First Division will publish its verdict soon on 3 disqualifications against former Senator Bongbong Marcos from joining the presidential race. But before that, Commissioner Rowena Guanzon is still looking for one more document. Guanzon has ordered the Marcos camp to file a notarized copy of the medical certificate that they presented during Friday's hearing that was issued by Dr. Benedict Valdecañas to explain why Bongbong was a no-show during that pre-conference last week. Guanzon learned about the seemingly conflicting details about the presidential aspirant's health condition. The commissioner was looking for Marcos last week repeatedly, but his lawyers simply first said that he was not feeling well. She did not take that answer. She was not satisfied with that, so she wanted that certificate. Pia?
Mel, walk us through the timeline. When did we last see Bongbong Marcos?
All right. So Marcos's last public appearance known to us was on Thursday afternoon. So that's the eve of the pre-conference when he attended his second radio interview for the day. So what happened then was Marcos started the morning with a first radio interview, and then his doctor visited him at home for a consultation at 10 in the morning. And then that second and so far final appearance, as we know now. And then his spokesman, Attorney Vic Rodriguez, explained that those speaking engagements worsened Bongbong's condition, and that's why they made that decision to let him rest on Friday, even though the COMELEC really wants him to join the proceedings, even if just via Zoom. And then his lawyers presented the medical certificate, which Guanzon once notarized, from Eagle Wellness Center, where the doctor claimed that Bongbong had difficulty speaking because he supposedly had sore throat and flu-like symptoms after getting exposed to two COVID-positive individuals. But when Guanzon learned about all this, the radio interviews, she said she will make the doctor explain. And Akbayan Party List, one of the petitioners behind the disqualification cases, said COMELEC should sanction Bongbong for lying to them. Back to you, Pia.
Mel, now that the case hearings are over, can you explain the arguments raised by the lawyers of former Senator Marcos against those petitions blocking his presidential bid?
Well, based on the memorandum that was submitted to COMELEC yesterday, Marcos's lawyers insisted anew that he is qualified to run as president this time because he was allowed to. There were no problems he encountered when he ran for previous positions, and he won in previous positions, except when he last ran as vice president in 2016. Upon the non-filing of income tax returns, which is the main argument, one of the main arguments raised by the petitions, the camp said Marcos didn't really have ill will, or it was not intentional rather for him to forget to file his ITRs. And they also argue that the penalties have been lifted already because they supposedly have paid all the penalties and fines imposed on him back in 2001. But this is still being questioned by the petitioners. His request is for the COMELEC to dismiss all the cases and to let him run in May. Pia, back to you.
Melissa Lopez there reporting. Now, here's an update on other 2022 presidential aspirants. Senator Manny Pacquiao vowing to push for a minimum wage of 50,000 pesos for healthcare workers. That is on top of other benefits such as the special risk allowance. Manila Mayor Isko Moreno saying the new Hospital na Maynila is expected to open its doors this year. Senator Ping Lacson says there is no time to tackle the proposal seeking to lift term limits in the 1987 Constitution. And Senator Kiko Pangilinan, the running mate of Vice President Leni Robredo, testing positive for COVID-19. Pangilinan says he has no symptoms. Now, customers of Meralco can look forward to a lower electricity bill on the first month of the year. The power distributor says the overall rate for a typical household will be at 9 pesos and 7 centavos per kilowatt hour this January, down by 7 centavos from last month. Now, that means residential customers consuming 200 kilowatt hours a month can expect a 15 peso reduction in their bill. Now, one of the world's biggest fashion magazines is getting a Philippine edition. Publisher Condé Nast announcing Vogue Philippines will be launched this September in partnership with Mega Global Licensing Incorporated. It is the 29th edition of Vogue globally and will come out as a digital-first media brand with a monthly print issue. And before we go, a reminder to keep all health protocols in mind. Amid the recent surge in COVID-19 cases, keep wearing your masks. The advice is double mask, a medical mask under, and a cloth mask on top. And avoid social gatherings. And if you begin to experience symptoms, immediately isolate, get yourself tested, and consult with your local government for the next necessary steps. Let's all do our part to curb the spread of the virus. And that is it for now. Join me again on news.ph at 7 p.m. Still here on Facebook Live, the CNN Philippines Facebook Live page. I'm Pia Ontiveros for Newsnight, where we go above and beyond the headlines.
According to research, dandruff affects approximately 50% of the general population worldwide. That's nearly 4 billion people. And while it isn't contagious or life-threatening for the most part, it can be quite annoying and oftentimes embarrassing. The good news is that dandruff is very treatable and it doesn't cause long-term problems. I'm Dr. Freddy Gomez. Our goal here on the program is to help you better understand the care you need and deserve. You're watching MedTalk Health Talk. Not a lot of people know this, but dandruff actually has nothing to do or has little to do with poor hygiene. It's actually a result of excess shedding of dead skin cells from your scalp. Now, here to help us learn more about this condition, with us is Dr. J.V. James Barrett. He's a dermatologist from the Philippine General Hospital. Also with us is Dr. Ana Aurelia Santos, who is a hair specialist from East Avenue Medical Center. Now, I'll start the conversation with Dr. J.V. muna. How can these symptoms of dandruff specifically affect a person aside from the obvious flakes on their head?
The most prominent complaint when it comes to dandruff, aside from the flakiness, is the itch. And the itch is quite persistent and it's quite irritating. So it's hard to do like your regular activities if, you know, it's itching and if you're gonna scratch your head sometimes, like when you're at school or at work, it's gonna be a bit embarrassing also.
Sometimes the lack of shampooing can cause an oily buildup in the scalp, resulting in dandruff. However, even if you wash your hair regularly, you can still get those pesky flakes. So, Dr. Tak, ano ba talaga yung rason kung bakit nagkaka-dandruff ang tao?
Stress definitely plays a role, as we have observed during this pandemic, where in a lockdown situation, our situations have changed from our usual day-to-day lives. Increase in oil in sebum production can play a role because this creates an environment na favorable dun sa yeast na nagkukos ng dandruff, which is Malassezia.
Now, it's no question that we're all living under very stressful times, and stress is, as you mentioned, linked to an endless range of health problems, including hair and scalp issues. Dr. JV, what happens kapag na-stress ang tao? Pag umabot doon, how does this trigger dandruff?
Yung stress po kasi, syempre, it kind of dysregulates or it kind of messes up our immune system. So yung sa skin po natin, yung immune response natin, medyo nagbabago. So kaya po nangyayari minsan namamaga yung balat. So like for example in dandruff. For example, there are other skin conditions that are triggered by stress. Yung pinaka-established is psoriasis, for example. Nagpa-flare po yung mga pasyente nating may psoriasis kapag nasa-stress sila. Sometimes more commonly, acne also can be triggered by stress as well.
Now, there are a lot of myths that surround the causes of dandruff, especially when it comes to hygiene. Now, the truth is the condition can develop kahit malinis ang scalp natin. Kaya, Dr. JV, when it comes to washing our hair, when is it too little or too much?
It's more of how oily your scalp can be. No? So, meron pong iba, especially for women, they don't shampoo as frequently because yung natural na sebum ng hair po natin ay yung nagbibigay ng parang magandang gloss at saka softness ng hair. no? So, pero po kung ikaw ay prone to dandruff, a more regular washing can actually help kasi it gets rid of the oil. And the quick tip talaga is to just increase the lather time or tagalan nyo lang kung nakababad yung shampoo sa buhok ninyo if prone kayo mag-dandruff para po mas matanggal yung oil kasi nga po it kind of promotes sometimes an environment wherein seborrheic dermatitis or yung dandruff can happen.
That's why I'd like to ask Dr. Tak, when it comes to dandruff, ito ba ay isang condition na merong lunas pang habang buhay or is this something that those with it have to learn to live with and control it and maintain it?
Definitely, no, our patients with dandruff, napansin nila na kahit they consult their dermatologist, prescribe medications, pabalik-balik pa rin po. So, I would like to say that it can definitely be controlled. But it's something po na you have to watch out for, avoid the triggers, avoid yung mga factors po na pwedeng mag-aggravate nito para po makontrol natin yung symptoms po of dandruff.
Now, if the skin on your body becomes scaly or itchy, your first thought might be because it's dry. But dandruff isn't necessarily directly caused by dryness. Now, when your scalp is red and flaky, it's usually the result of some form of inflammation. Dr. Tak, explain natin to. Anong role ng inflammation pagdating sa dandruff?
Usually po kasi kapag nangyari po ang inflammation, kapag nakakamot natin yung ating scalp dahil nga makate due to dandruff. So, kapag nakamot natin, there may be some redness na nagre-result. So ito po, we have to watch out for this because this can lead to other factors that can worsen our dandruff.
A flaky and itchy scalp doesn't always mean that you may have dandruff. If you've been using medicated shampoo for a week or two and don't see any improvement, the culprit may be something else. When we return, we'll talk about what might be causing your scalp to itch. We're your connection to healthcare. You're watching MedTalk Health Talk. Now that the country is starting to loosen up its quarantine restrictions, we're seeing more and more people out of their homes and exposed to the environment. But how is dandruff and the weather connected? I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines. We're together in health. For the most part, we only have one climate here in our country. Very warm. But changes in temperature and humidity can be a trigger for dandruff. Dr. JV, how can the change in season, change in weather, affect a person's scalp?
For dandruff, for example, ang established is when it gets triggered on the cooler seasons. No? But it gets better usually when it's warmer, when it's summer. No? When it's like summer, for example, they say that the sun exposure actually helps relieve the dandruff. No? Like with the exposure to the sun, it might improve actually some cases of dandruff.
Now, Dr. Tak, marami rin nagtatanong, can wearing a cap help with dandruff or does it actually worsen it?
Actually po, in wearing a cap, it doesn't actually do anything, no? So I think the patients wear the cap more of kasi medyo nahiya sila na may mga visible flakes on their scalp. So I would say po, no, it has no effect.
Dr. Tak, marami rin ang naniniwala that not rinsing off shampoo or other hair products, yung mga gel, mga mousse, or mga wax, can this directly cause dandruff? Or is there any truth to this?
It can play a role because these products, kapag hindi po binanlawan thoroughly from the scalp, it can cause product build-up. So we really recommend that when you shampoo or you use these products, you rinse it thoroughly when you shampoo your hair.
And Dr. JV, when it comes to dandruff, can this get to a point where merong malalang sakit ang isang tao? Can this be a cause for infection?
Yung dandruff po kasi is very, like, it's formally called seborrheic dermatitis and the dandruff is the mild form. No, sometimes it can worsen, no? And mas, yun nga po, yung parang dinescribe natin kanina, mas makakapal na, mapupula na patches, mas makakapal na flakes yung pwedeng mangyari. It can extend to the face, the ears, the nose, sometimes po to the upper chest and back kung saan marami din tayo yung sebaceous glands natin or oil glands natin. No?
Yung paglipat ba ng mga different products, let's say may isang taong gumagamit ng shampoo, they tried something else, can this lead to possible dandruff?
Not necessarily. No? The rotation of shampoos actually might help, no? But you have to consider that there has to be active ingredients that may help with dandruff. No? Pero just rotating shampoos in general, that doesn't affect dandruff per se.
Now, aside from dandruff, there are other reasons why your scalp might be itchy. Dr. Tak, please explain some of these conditions to our viewers. Anong yung mga pinaka-common dito that Filipinos might be able to experience?
We have scalp psoriasis, so this can also cause scalp itching. So definitely, if your dandruff does not improve with anti-dandruff shampoo, then definitely consult your board-certified dermatologist because it can be something else. We can also have contact dermatitis, so the use of maybe the dyes, hair dyes we use in our hair. This can also produce itching in our scalp kapag hindi po tayo hiyang dun sa dye. Also, in newborns, there is a condition called cradle cap. So it's greasy, yellowish, brownish scales on the scalps of newborns, which usually goes away on its own and does not usually require medical treatment.
That's a good segue actually, Dr. Tak. You mentioned that pwede rin magkaroon ng simptomas ng dandruff ang mga baby, mga bagong panganak, which can be very anxiety-producing, lalo na sa mga first-time parents. Ano mga advice mo pag meron silang nakitang kakaiba sa kanilang anak? What should they do? Anything? Kailangan bang consult kagad? Or are there some home remedies that may be able to ease the experience of the baby?
Yes, so sa ating mga mommies na may ganitong experience with their babies, first of all, don't panic. Then you can massage mineral oil on the baby's scalp to loosen these flakes and use mild shampoo to gently wash baby's hair and rinse it thoroughly sa scalp ni baby. Then brush hair gently with a brush that has soft bristles. Again, don't worry, it usually goes away on its own.
Dr. JV, earlier kayo ni Dr. Tak were mentioning about seborrheic dermatitis. Kapag ang isang tao ay may dandruff, automatic na meron din siyang seborrheic dermatitis?
Yes, technically that's true. Kasi seborrheic dermatitis po talaga yung tawag dun sa sakit. And dandruff is the mildest form of it, usually.
What are other conditions that fall under this that could be triggered and could lead to more serious conditions?
It's more of, pag mas malala po siya na umaabot yung hanggang mukha. Like, ang term na lang po talaga namin, seborrheic dermatitis. Meron po yung, there's this entity, especially in, for example, with persons living with HIV, na medyo severe siya, tapos nagmumukha na po siyang psoriasis. They say it's SIBO psoriasis. No? Some believe na parang seborrheic dermatitis and psoriasis exists in a continuum of some sort. Kumbaga parang pwedeng mag-lead on to the other, pero hindi po naman yun, it not necessarily is true. No? Although minsan parang it's really just a very severe form of seborrheic dermatitis. And psoriasis can be a totally different thing altogether.
So this is just for our viewers to stress the importance na kailangan talaga magpakonsulta sa dermatologist, lalo na para maka-achieve tayo ng tamang diagnosis ng problema. Now, Dr. Tak, I'd like to ask, what is the worst thing that people do to their dandruff that makes it worse?
Usually when they pick off the scales, kasi I understand, no, sa ating mga patients, very tempting na kutkutin, lalo na pag ang kati-kati ng ating scales. Actually, it may have a tendency na mas kumapal palalo yung scales kapag kinukutkot natin. And of course, pwede rin na magkaroon ng infection. Some also resort to other parang to their own parang mga concoction that they apply on the scalp, which can actually make it worse.
Now that we know the different causes of dandruff and other scalp conditions, we'll talk about how to treat and prevent these effectively. So stay with us. Your health is our mission. This is MedTalk Health Talk. The itching and flaking from dandruff can almost always be controlled. Now, the best way to get rid of dandruff is to use medicated shampoos and some topical treatments. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines, where your care always comes first. For mild dandruff without a specific cause, over-the-counter products can help manage flaking as well as the itchiness. Dr. Tak, what are some of the ingredients that we have to look out for when buying anti-dandruff shampoos?
So please keep in mind these ingredients. These ingredients will help in the controlling of dandruff. So ingredients such as ketoconazole, zinc pyrithione, or selenium sulfide. So these ingredients will help in controlling our dandruff symptoms.
Okay. So, Dr. JV naman, is there a right and wrong way on how to use these shampoos for dandruff treatment?
I think the most effective way to use it is to use like a more generous amount. So you use around 5 to 10 ml of the shampoo, and you lather it mostly on the scalp. No, it doesn't have really to go to the hair. And for women, for example, or with men who have longer hair, they can use actually different shampoo for their hair. And the medicated shampoo usually just stays on your scalp. And if affected din po yung other areas like yung dito sa eyebrows or sa little nose, you can actually lather them on. And then you can leave it on for around 3 to 5 minutes, and then you rinse them. And usually, you can just use it around 3 times a week.
Now, for those who want to go for home remedies to treat dandruff, Dr. Tak, when it comes to home remedies, you touched on this earlier, no? That very careful dapat ang mga viewers natin when especially doing home treatments, lalo na pag passed on yung information ng kaibigan or kapitbahay. Are there any signs that could tell na things aren't going so well? Anong mga red flags ang dapat alalahanin ng mga viewers natin when it comes to home remedies or even the shampoo that's used for dandruff?
Yes, so we have to be careful when we self-medicate. So, ang mga red flags that we have to watch out for na baka nga hindi talaga nag-work yung ginagamit nating home remedy. Kung mas lalong dumami yung flakes, mas lalong kumate, and baka namamagana or namumula or nagiging masakit na or may painful sensation in our scalp.
Can dandruff lead to hair loss, permanent hair loss?
Yes, so of course, you have to consult your board-certified dermatologist to give you the proper management. Wag po palalain ang ating dandruff, wag hahayaan na mas lumala ito kasi pwede nga pong dulot po ito ng paglalagas ng buhok.
Dr. JV, aside from yung mga treatments natin, we always want to emphasize that prevention is better. What's some good prevention tips na you can give our viewers when it comes to dandruff?
First, once na-establish na po yung dandruff nila, sometimes yung sa medicated shampoos natin, you can actually maintain them. Like you can use them once a week para kumbaga meron kang pang-control ng dandruff mo during certain periods of time. Also, syempre, if you know that stress can trigger your dandruff, you try to ensure, like you can try to ensure na hindi ka masyadong stressed. Although that might be difficult to do.
I think that would be very difficult to do, especially nowadays, Dr. JV. Dr. Tak, any advice for our viewers when it comes to dandruff and probably trying to prevent it?
To add to what JV said, so we can avoid using hair products that can actually irritate more our hair and scalp. So these products are alcohol or bleach. And I think he also mentioned yung stress, which is very hard to do, to avoid during this time. So yes, do take up a new hobby, do light exercises, kahit walking around the house lang or around the outside of your house. Do yoga and deep breathing techniques to better manage your stress.
This discussion was definitely very helpful, and thank you to our guest, dermatologist Dr. JV James Barrett and hair specialist Dr. Ana Aurelia Santos. Maraming salamat sa information and expertise ninyong dalawa. Dandruff can be annoying and embarrassing at times, but it usually doesn't indicate a more serious health issue. Itchiness and flakiness often respond well to over-the-counter shampoos and scalp treatments. And despite these stressful times, make sure to make time to take care of yourself. We want to be your partner for a lifetime of good health. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk.